Hi, I'm Dr. Henry Black from the New York University School of Medicine and president of the American Society of Hypertension. September has been a very interesting month for new clinical trials. At the European Heart Association meeting recently held in Munich and recently in the New England Journal and Lancet have been publications on the TRANSCEND and PROFESS study. TRANSCEND was related to ONTARGET, something that was published and presented about 6 months ago. Individuals with known ACE inhibitor problems or intolerance to ACE inhibitors, or who developed intolerance during the 1 month wash-in period for ONTARGET, were placed in TRANSCEND. Nearly 6,000 people of the 35,000 they enrolled were in this group. PROFESS was a very complicated study, also looking at key issues right now, in this case secondary stroke prevention. This enrolled over 20,000 people, half of whom got a combination of aspirin and extended release dipyridamole compared to clopidogrel in people who've had strokes within initially 15 days, and finally this was extended further. What was interesting and what puts these two studies together is that telmisartan, a very effective angiotensin receptor blocker, was randomly given to the people in TRANSCEND compared to placebo, and to half of the people also on a randomized basis in PROFESS. We would certainly have expected that addition of an antihypertensive therapy to people who've had strokes would prevent strokes by lowering blood pressure. Well, the results turned out to be pretty confusing and need us to re-examine many things. In TRANSCEND, for example, things were pretty much equal, even though this was comparing a placebo to an active treatment. But since the investigators were very concerned about getting blood pressure to goal levels, the people on placebo, as it turned out, randomly selected, got much more in the way of diuretics, got more calcium antagonists, and more beta blockers. So the blood pressure was very minimally different. In PROFESS, the same thing happened. People got their blood pressure controlled well, and there was only about a 4/2 millimeter difference, which we would have thought, at least I used to think, would have had a big outcome advantage in the question of recurring strokes. Both studies were considered by the analyses as being underpowered. TRANSCEND was a non-inferiority study with very tight rules. The outcomes are almost identical, but it didn't meet the non-inferiority criteria. Now, non-inferiority is an arbitrary term. When you see exactly the same rate of events, you think it's probably the same. But it didn't reach the non-inferiority boundary, so the investigators couldn't say so. In PROFESS, there was no advantage to either of the two therapies. There was more side effects, in fact, with the extended release dipyridamole plus aspirin compared to clopidogrel, more bleeding, and the addition of telmisartan didn't improve anything. So right now we're faced with two large, very complicated, multi-thousands of patient studies that haven't given conclusive results. We need to start thinking about doing trials in a better way. There are very few studies these days when we compare active therapies that really are going to tell us what to do. Non-inferiority studies are certainly useful, equivalent studies are certainly useful, but the interpretation of those is going to take some doing. Thank you very much.